Hello, everyone. Welcome back. In this set of video lectures, we're going to be covering the coding of mental health disorders. So let's have a look at these codes. And again, this is Chapter 8, Mental, Behavioral, and Neurodevelopmental Disorders. These codes all fall into code categories F01 through F99. And again, as we've done in the past, please make sure that you review the terms in your book. Your book has a nice set of key terms in each chapter usually, and answer the questions that pop up on screen. They'll help you retain the material and understand it better. Again, as we talked about, these are both disorders, personality disorders, and they also cover such things as schizophrenia and other different types of things. Let's split as follows. Mental disorders from known physical causes are F01 through F09. Disorder from using substances like alcohol or drugs are F10 through F19. And schizophrenia and psychotic disorders are in the F20s. We also have codes for what we call mood disorders. These are things like depression, bipolar disorder. We also have anxiety and stress disorders. The mood disorders fall in the F30 code categories. The anxiety and stress related disorders fall into F40 through F48. We also have eating disorders and other behavioral syndromes in F50 through F59. And then behavioral disorders in adults are in F60 through F69. Intellectual disabilities fall into the F70 through F79 code categories, and F80 through F89 pervasive and specific developmental disorders. And then F90 through F98 are the behavioral and emotional disorders with onset occurring in childhood and adolescence. And then we have, of course, as we do many times in ICD-10, we have F99, which is the catch-all unspecified category for mental disorders. Something you'll hear about when coding mental disorders is DSM-5. And DSM-5 TR gives a detailed description of each of these disorders. Providers use this to diagnose and treat patients. As a coder, you must use a code based on what's written in the medical record. Sometimes we'll see such things as it becomes major depression when you're on this med and that med. That's really not factually correct. You need to follow what's documented in the record, and sometimes that can be a challenge with mental health. And again, DSM-5 provides descriptions. These allow clinicians, not just physicians, psychiatrists, but psychologists and others to diagnose, communicate about, study, and treat patients. There are definitions that appear in DSM-5. They're pretty consistent with what you see in ICD-10-CM, although there is a little bit of variation. The DSM-5 book also contains dual codes as well as all the new ICD-10-CM codes. ICD-9-CM and ICD-10-CM codes are included in parentheses within the DSM-5 codebook with their codes for reference. Medical conditions due to psychoactive substance abuse, and dependence. This gets a little bit complicated, so I'd like people to pay special attention to this. You need to use and assign the code for the mental condition as directed by the alphabetic index along with the psychoactive substance abuse, or dependence code. So, for example, we have a patient with alcoholic pancreatitis due to alcohol dependence. You assign the appropriate code from K85.2, alcohol-induced acute pancreatitis and the appropriate code from subcode category F10.2. For instance, F10.20, this is alcohol dependence uncomplicated, right? So we would not use the F10.288 alcohol dependence with other alcohol induced disorder. So you have to follow the documentation and follow things rather carefully. There are a lot of instructional notes in this chapter. You need to read them all carefully. These are our usual instructions, code also, see also, etc. So this will be another chapter where if you just go by what's in the alphabetic index, you will not find the right code. There are chapter specific guidelines. An example of this is the pain disorders, coding F 45.41 for disorders exclusively psychological versus F 45.42 pain disorder with related psychological factors, right? And then you would use also the code from code category G89 for acute or chronic pain. So a lot of involved things that we have to pay attention to here. And then again, if a patient has a medical problem because of substance abuse, we need to code both the medical condition and the substance abuse. And we see this here with pancreatitis again, one that we see a lot of in the emergency room setting and other places. And last slide for this lecture, codes are organized into related sections. And again, as we would always do, we need to follow the physician documentation and follow all those instructions about coding related conditions and manifestations. And again, that's all I have for you in this video lecture. Come back and we'll be talking more about multiple coding and other coding topics with coding mental health disorders. Bye now.